Welcome. And today we're talking about non-invasive treatments for headaches. And I know many people are like, I have no idea what the heck that means. And that's what we're going to explain to you today, exactly what that means. So thank you for joining us, and we will give you an idea about exactly what does that mean. So for those of you who are live, please ask questions as you so deem fit. For those of you who are catching us at a later time, leave your comments in the chat, whether that's YouTube or Facebook. So this is Cutting Edge Pain Relief. I'm Dr. Orlando Landrum, and I'm here to give you another tidbit about how to be able to treat pain in a different way than what you've probably been told about before, and how to be more functional, punch pain in the face, and get back to leading the life that you deserve. So today we're going to talk about headaches. And specifically, most people, when they think about headaches, they think about migraines and them being very difficult to treat. Historically, it's been the utilization of different types of medications, things like ergotamines or things of the nature of Embistatin and Imitrex and other things along those lines in terms of medications that are either injectable, intranasal, or oral medicines. But one of the things that we want to talk about is how new cutting edge technology is really progressing the field for treating migraines. So one of the newer medications that's out there are things like Wearable and other medicines of that nature, which have been huge in terms of dealing with good success rates. The challenges are that most of the time you have to either have an injectable, an infusion, or still an oral medicine with those. But what we're going to talk about today are going to be non-invasive type therapies. And one of the places where you can find this in written print, so you can be able to take a look, is within the Journal of Practical Neurology that talks about neuromodulation therapies for headache. It was actually published, as you can see, in May 2019. So it's been out for a little bit of time. And one of the things that they list is a few different types of therapies that we're going to go over and give you insight in terms of how they work, how would you apply them, whether there's insurance coverage, all those type of things. So this chart shows the context of 4 different types of therapies, and we're going to talk about some of the nuances of those. One of which is called gammaCore, the second of which is called Enura, the third is Statistically, and the fourth is Nerivio. And so when we get into those different types of therapies, they're basically all non-invasive therapies, meaning there's nothing that's inserted underneath the skin. You apply it similar to a TENS in some ways. Sometimes there's an adhesive, sometimes there's not. And through different regulatory mechanisms using neuronal components of the pathways of your body, it ends up impacting your pain and making a migraine or other type of headache better. So I know that was just a mouthful, and many people are just like, okay, I'm not really understanding exactly what you're saying. So I'm going to explain that a little bit differently. Basically, you take a device, you put it on the skin, either on your head, on your face, your throat, or another part of your body, and it talks to your nerves to then calm down the areas of your brain that really give you perception of the headache. Sometimes it deals with certain nerves that are called the trigeminal vascular system. Sometimes it deals with other areas of the brainstem, and it, in essence, is able to stop your pain and many times prevent it. So let's talk about the first one of those different types of treatment options, and that's something that's called gammaCore. So gammaCore, as you can kind of see with this pictorial representation, is a picture of someone placing a device right at the aspect of their throat, and what they're targeting is a nerve that's called the vagus nerve. And what it's able to do is to provide pain relief by stimulating the vagus nerve. So exactly what does that do? Well, it's a small device, give or take, that's somewhere around 4 to 5 inches or so in size. And it basically stimulates the electrical component of the vagus nerve. And in doing so, it's able to sometimes not only be able to reduce medications, sometimes it's able to be able to stop medication use by providing relief. So when we talk about things like this, people are like, well, is this really valid? Does it have truth to it? Are there studies? And yeah, there are studies behind all these different products that we're going to talk about today. And this particular study, one of the things that they looked at was how did it impact the context of pain, particularly within migraine and cluster headaches, and it evaluated it with standard of care of that gammaCore plus traditional medications versus placebo or control. And what they're able to see is that there's statistically difference in terms of the number that it lessened headaches by, if at all stopped them. And they were able to see that repetitively throughout that study that they looked at. And there's actually other studies that looked at the efficacy when we look at this NVNS, which basically stands for non-invasive vagal nerve stimulation, and you look at its utilization. And if you use it in 0 months, and then after 2 months, and then after 4 months, and so forth and so on, what you can see on the y-axis is the frequency of the headaches and their reduction, and how much less they are depending on how long you would use a product for. So what many people would say is, okay, well, what does it feel like? Well, as you get into the context of the videos and what it sort of describes how it feels basically like a tingling sensation that's present in the neck, and sometimes that can go to the context of the lips, but you never have any convulsive type symptoms or anything where it feels like you're going to have some significant like spasm or seizure or anything of that nature. It's more of a tingling type sensation that you'll feel and kind of experience. So let's see if we can be able to pull up for you exactly how that is perceived and how you would experience it, so that you can get a better idea about exactly what you'd be perceiving. So 1 second. So what you're going to see is a quick video. It's going to show you what that gammaCore piece looks like.
This short video will introduce you to your gammaCore Sapphire and show you how to use it. Let's get to know your device. The safe and gentle electrical stimulation is delivered through the 2 stimulation surfaces. To turn gammaCore on, press the power button. When the device is ready for use, it will beep once and show you the number of days and the number of stimulations you have left. When you adjust the intensity, the display shows the intensity level, which ranges from 0 to 40. The top of the control scroll button increases the intensity of the stimulation. The bottom
Okay, so sorry for our video technical difficulties here, but basically you kind of got the gist, is that it, in essence, is able to be programmed. It's a handheld device. You place it to the context of the vagal nerve, and that vagal nerve stimulates the aspect of the neck, and it provides a fair amount of relief, both in the acute phase as well as from a preventative standpoint. And so one of the things that really immediately kind of comes up for most people is, okay, I get it. So what's it going to cost? And one of the challenges is they haven't really worked it out as well as what they probably should. But the context is that it can not only be able to help for acute and episodic cluster as well as migraine, it also can be utilized for some forms of cluster and tension type and be preventative. So at the end of the day, the cost itself can be a bit pricey because it isn't traditionally covered by insurance. However, veterans actually can be able to acquire it through the VA pretty much for free. And so if you're a veteran or you know someone who's a veteran and has headaches, which right now the reports are that about 26 to somewhere around 29% of veterans have headaches post-service, is that it may be able to provide value to them without them needing another medication. Okay, so moving on, one of the things that we're going to talk about next is that context of what we talked about earlier, and that is the eNeura. And so the eNeura device is actually a little bit different. What it entails is the use of transcranial magnetic stimulation. And so if you watch some of our talks before, we've talked about TMS. TMS itself is a much more prominent utilization for things like depression and other symptomatology, but it's had a role in utilization for headaches as well. Traditionally, what you see is a much larger machine with two different bands that you place in different areas of rings where you stimulate the brain using magnetic energy. And so within that context, what they decided to figure out, this company, was how could we be able to do this in a portable device that you could be able to use at home? So as you take a look at this timeline, it talks about the first use of that context of demonstration of muscle stimulation back in 1786. And you can see the development of magnetic use somewhere from the 1910s to 1970s until currently. This was originally produced in 2007. The cool thing about eNeura is that you can be able to do it, like I stated before, by yourself at home. It's a device that you place towards the posterior portion of the head, and you would pulse it, and it would give you energy within that region. As you can tell, or probably guess and surmise, its efficacy was pretty darn good, where it reduced headaches by at least 50%, and had a pretty significant statistically difference between that versus placebo. The main challenge with it is that it really had issues with being able to be covered by insurance. And what they ended up finding out was that the company wasn't as sustainable. So there's a number of people who are still using the device, have the device, and it's able to be sustainable, but producing further of these machines. They filed for bankruptcy, I want to say about maybe 2 years or so ago, but I think they're trying to make a second attempt at being able to come back and be able to really produce products. So for right now, this is one of the treatment options that's out there, really isn't as sustainable. Conversely, there's actually a really popular product that has done incredibly well for headaches, and that is what I was just showing you on the screen, and that is Cefaly. So if you can see that in the second paragraph, Cefaly, it treats migraines and also has been used to treat occipital headaches. And how does it work? As I alluded to earlier, as it says in this paragraph, is that many aspects of migraines and other components of headaches involve the trigeminal nerve. And what happens is this is placed at the top of the forehead, and it catches one of the branches of the trigeminal nerve, and that electrical impulse that's placed there through the use of an adhesive electrode is able to stimulate the trigeminal nerve, which is able to reduce both the frequency and intensity of migraines. And so the initial formulation of this was in one context, which is the older Cephally version. And now there's a newer Cephally version that really actually is even more unique. And one of the things that it talks about is the number of people with migraines that they've treated, which is 2 billion since 2008, and they've sold over 350,000 devices. An interesting thing about this is that this device is able to be purchased on Amazon. It's able to be covered by insurance, as well as there's context for utilization for veterans as well. So when we take a look at Cephally, one of the things that we see is that it can be used for both acute as well as chronic, that the updated context is that it can be provided for about the cost of about $379. And then if you decide not to purchase it, you could try going through your insurance and see if it will give you value via that mechanisms as well. The one thing is, so you do have the adhesive strips that you connect to that sometimes can be pricey, but really isn't that prohibitive. So as a device, it's probably one of the most successful devices throughout. As you can see, they've partnered with the VA as well to be able to make for an easy access for veterans and be able to reduce medication treatment as the mainstay or the only treatment for a number of different patients. So then the other device that we're going to talk about, or the final device that we're going to talk about, which was alluded to in this article down here, the lowest one, is something that's called Neurivio. And it's a different type of product completely. So as products go, you would expect that it would be something that would be more utilized for peripheral pain, possibly for muscular pain, because it operates through a different mechanism entirely. And how it works is it's a device that actually looks like this. So it's sort of an armband, but you're like, yeah, but I have pain in my head. How is this armband doing it? And we'll kind of give you a further understanding about that. So technology is that it uses electroneuromodulatio that's remote. So in essence, you place this on the upper arm and it uses the peripheral nerve to really be able to do something that's called endogenous analgesia, which is it stimulates the nerves that then impact different parts of the brain in order to be able to get a good response. So you apply it with this band, you adjust it with this type of smartphone app, and the stimulation goes up to the brain, stops headaches, relieves headaches, and can be both acute as well as preventative in nature. And so when we talk to many people about headaches and non-invasive neuromodulation, they have no idea what the heck we're talking about. Frequently they're like, neuromodulation, is that spinal cord stem? Is it peripheral nerve stem that's placed underneath the skin? Is it a occipital nerve stem, or is it a TENS unit? And so what we want to make sure is that our viewers and those people that support our channel as well as our practice have an understanding about different options that are out there and where they're progressing within the context of being able to be provided by your healthcare providers, as well as being covered by insurance. The different ones that were mentioned today, the 4 different ones that are in place, Cephally is probably the most progressed in starting to look at connection with payers. And they've also tried to be able to have a reasonable price point that provides for not only sustainable good treatment, but also a cost-effective option as well. So question of the day, for those of you who have headaches, what have you tried that really have given you some degree of relief? If you're live, shoot us a message. Has it been Botox? Has it been oral medications, intranasal medications? If you're watching this at a later time, please leave it in the comments so we know. And for those of you who have tried a non-invasive neuromodulation therapy for headaches, what did you try and how well did it work? Would be really interested in understanding it. For those of you who are thinking, oh, well, I mean, could this be similar to a TENS unit? It's different. both the waveform as well as the targets of what we're trying to be able to accomplish in terms of getting that headache relief are completely different. And how these technologies are revolutionizing how pain is treated is considerable, because not only does this have potential benefits for CNS or for migraine type components, one of the things that we can look at is how will this be able to be used either in conjunction with an invasive device or be able to be used for other parts of the body in the future. If there's a way to be able to impact what's happening in the brain, we may be able to impact what's present in the body. For those of you who joined us on a weekly basis, we really appreciate you following us. And if this is your first time, please subscribe to our YouTube channel so you can hear more options about how to be able to punch pain in the face and get back to leading the life that you deserve. Thank you so much for joining us. I know that I have some people that are mentioning that they use magnesium, they use ice packs in order to be able to get some relief. And clearly those type of options don't put you in a bad spot for having, side effects from it. And these type of options are the same type of, really fit a similar pattern, where if you use this, you're not going to have those same type of side effects that you might have with other type of headache kind of medications. So thank you so much for those of you who joined us. If you found this video of value and you like videos like this, please hit the like button. Let us know. It's useful for us to be able to make a determination about what videos do we produce and what do we not produce. What's a better video for you to have some context of understanding, so we can be able to help you get better insight about your condition, how you can be more functional, and how you can lead a better life. Again, thank you and have a great day.